Hello, my name is Justin Garrett, and today I've decided to choose my topic as diabetes as my final presentation for the classroom. This slideshow will go over a brief overview of what my presentation will entail. Throughout the different slides, I will talk about each one that we'll cover. We're going to start out with diabetes, a look at a growing issue. In my slides in the future, as you'll see coming up, we'll talk about different things such as pathophysiology, signs and symptoms, the treatments for diabetes, control of diabetes and precipitating factors, things that people have acquired or may have acquired in their past or hereditary or diet, exercise, MIs in the diabetic patient, and how they can be tricky to diagnose based on neuropathy of the diabetic patient, and sometimes they're the silent killers. And then we'll go over wound care and peripheral neuropathy. Taking care of wounds is a huge issue with diabetics, especially in their feet, so we'll cover that for end of the chapter. And then awareness for the diabetic, how we can raise awareness in our child. So pathophysiology, we'll talk about how diabetes type 1 occurs, how type 2 diabetes occurs and the similarities and differences to those and the signs and symptoms throughout. We will talk about diabetes insipidus and then how the body reacts to this disease. So the pathophysiology behind the diabetic and what is going on inside the body as this process occurs. Type 1 diabetes, we will discuss glucose and insulin levels and how they change throughout the body and what the pancreas is doing to cause this process. In type 2 diabetes, we will talk about the changes that occur within the stomach, the blood vessels, and how glucose interacts and the pancreas and its development of insulin. Recognizing diabetic signs and symptoms. Some people actually do not know they're walking around with diabetes. They can be as subtle as always being tired, blurry vision, sexual problems in the bedroom, thirsting, always frequent urination, polydipsia, polyuria, polyphagia, always having the need to feel like they're constantly needing to eat, and also limb impairment. Then we will discuss treatments for diabetes. Most diabetics that are around for type 1 diabetes know about their insulin shots and oral medications. They're pretty good about making sure that they're up to date on them, making sure that they're eating when they're taking their insulin. And then controlling your diabetes. So how can we control this through diet, exercise, and blood pressure control? This is especially true through type 2 diabetes, which is adult onset. So how we can raise awareness also into the society about how to control your diet, and then weight loss, as we know that obesity is a growing issue in this country. So just the balance of a good overall healthy diet, making sure that we're getting lots of fruits and vegetables, breads, other cereals, and we're really controlling how much fat and sugars that we're intaking on a daily basis. And then we'll discuss pathophysiology of the MIs, kind of what makes it different in a diabetic patient, signs and symptoms, and why a sample is so important to get from them. Knowing that someone has chest pains, also has a history of diabetes, can lead us down a different pathway. And then as I explained earlier, wound care in the diabetic patient, just making sure that we're taking care of stages of wounds, infection signs and symptoms, and how we can also be acute care providers and make sure that we're educating our patients as we see them in the field. And then we'll close it up with adult diabetes awareness. That starts at an early age and the different types.